Hi everyone, this is called Suture Basics. So in this video we wanted to share some information that we have on suture, and as members of the surgical team, RNFAs deal with suture very frequently. And before we get started, I wanted to remind everyone that I'm a registered nurse first assist and I am in no way giving medical advice here. I'm simply just sharing my opinions and my experience from working as a registered nurse in the operating room with everybody, so that hopefully it can help educate and improve people's practice. So now let's get started with some suture basics, okay? So the history of suture. So the use of suture for wound closure is a good technique, but it's definitely not a new technique. In fact, this form of wound closure has been around as long as man has been documenting medical data, basically. So reports of suture being used can be found as far back as before the Common Era, so in the BCE time. So although the material is used and the way suture is sterilized and packaged is constantly changing and evolving, the concept of using suture and securing it with knot tying technique is thousands of years old. So historically, what did people use as suture material? Basically, they used whatever was available. So things like hair, ew, pig bristles, ew, flax, bark, hemp, and silk, which is actually still commonly used in the OR, were common suture materials historically. So suture material has definitely evolved over the years, especially with the adoption of germ theory and sterile technique. Obviously, we use different things now, but very, very similar applications. So why is suture so popular? Well, there's a few reasons why. There's many reasons why, but I'm just going to outline these three because I think they're good reasons. So suture is easy to handle. Suture handles similarly to like a sewing thread or a thin kitchen twine, and maybe like a coated monofilament suture is kind of like handles like a string of dental floss maybe. So suture is easy to grab and manipulate with your hands. Second, suture tolerates wound changes. So suture has some give and flexibility to it. So as wounds go through different stages of healing, suture can adapt to those changes, especially when we're talking about wound swelling. It works very well with that. In the case of absorbable sutures, wounds heal slowly and the suture slowly breaks down. So it really tolerates those wound changes nicely as well. The third reason that I wanted to point out is the price point. Regarding the price point of suture, although there is quite a bit of variation in the pricing of different kinds of sutures and suture material, overall suture is relatively inexpensive when compared to some suture substitutes. So let me give an example. The application of dermal suture would be less expensive than the application of using dermal staples. So to make myself clear, I'm not saying that suture is a better option than another wound closure, but there's advantages and disadvantages. And in this scenario, based on cost structure, the advantage of using suture is superior. So the next thing we wanted to talk about was some important suture terms. The first term that we're going to talk about is tensile strength, and that's basically the breaking strength of a suture. Generally, sutures that are thinner have less tensile strength than sutures with the same material that are thicker. Thick suture, I think of this kind of like on a number line. Thick suture would be sized from like 0 to 10, 0 being the thinnest of the thick suture, 10 being the thickest. That's for thick suture. Thin suture, when we're talking about thin suture, it will have a -0 after it. So we'll say like 1-0 suture, 2-0 suture, all the way up to 12-0 suture. And again, think of it as a number line. 0 would be in the middle, and then we have 1-0, 2-0, 3-0, with 12-0 being the thinnest. Next is a suture memory, and that's the tendency of a suture to return to its original shape. And in another video or in a short, we'll discuss how you can get rid of suture memory and suture that have a lot of memory. Generally, those are your monofilament suture. Barb suture, we're going to put a picture of barb suture on here. It's suture with barbs on it. It's a knotless suture. It's very time efficient, and it basically grabs onto tissue and approximates skin edges. Next, we have dyed suture. That's suture that can be dyed different colors and it helps with the visualization. And it's not ideal for when you're suturing close to like a epidermis or close to the skin because sometimes you can see the dyed suture through there. Next is coated suture. So suture could be coated with different materials such as antimicrobials or things that will help it slide through tissue a little easily. So next we're going to talk about absorbable versus non-absorbable suture. So one of the wonderful things about using suture is all the options you have available to you. So first we're going to look at one way that we can classify suture, and that's absorbable versus non-absorbable. So an absorbable suture loses tensile strength over time, and that time can vary from weeks to months based on the material that you're suturing with. And this is really good for internal tissues of the body that will heal upon approximation. Hi, Angie. Hi. And it's also good if it's going to be an area that will be very difficult to reach to remove the suture. So absorbable suture is a great option in these instances. Next is non-absorbable sutures. So these are sutures that do not dissolve, and if they're left in a hard-to-reach place, they will stay in the body. So these are long-term suture. These are things used for like vessel repairs, anastomosis, like tendon and ligament repairs, often in orthopedic procedures, permanent ligation, things to close fascial defects, hernias, things like that. So implant placement. And then you can also use non-absorbable suture as a skin closure, but that's with the intent of removing the suture after the wound has healed appropriately. So another way that you can classify suture is synthetic versus natural suture. So first we're going to discuss some properties of synthetic suture. So synthetic suture are comprised of man-made materials. And as if you can see, after where I said comprised of man-made materials, you have all these like crazy looking scientific names. Yes, those are the scientific names of the different suture material that we used, but commonly we like refer to them almost like by their brand names. We'll call them like Vicryl, PDS, Monocryl, Biosin, and I will show you how to get suture charts so you can see the scientific name and then also like the brand names for these suture. So the advantages of using synthetic suture is they're more predictable than natural suture, particularly in their loss of tensile strength and being absorbed by the body. Also, there's a huge variety of synthetic suture available, and that's really nice because some of them handle different ways, so you can be very specific about how you want to use them, and you can find a really good suture for the area of the body that you want to work in. The next thing is synthetic absorbable sutures. They degrade by hydrolysis, so water in the body helps degrade those suture, and that's a little different from a natural suture, the way natural suture breaks down. So in contrast, natural suture has been around and withstood the test of time. These are things like your silk suture, your plain gut, and your chromic gut. So the disadvantage to using a natural suture is they tend to cause a little bit more inflammation in the body, and they're a little bit less predictable than the synthetic suture because they are natural. So natural absorption is through proteolysis, and I hope I'm pronouncing it correctly, but it's basically enzymes in your body breaking down the proteins that are in these sutures. So they absorb in the body just a little differently, and I wanted to point that out. And last but not least, another way that you can classify a suture is monofilament versus multifilament. Monofilament suture are single-stranded and they're less surface area than a multifilament suture. The advantage to using a monofilament suture is it passes through tissue easily. Think of it like a piece of dental floss. It's very slick. It causes less inflammation, less inflammatory reaction, The disadvantage is there's generally more memory in these sutures, so they're a little more difficult to handle when you're tying. And because there's so much memory in them, that increases the risks of the knots that you're tying to loosen. So it's very important with this suture to tie square knots. And then to get rid of suture memory, you just hold the suture and you just kind of tug on it to try and get rid of some of that suture memory. We'll show you that in another video. So if you don't understand what I'm saying, no worries, we'll cover it. Multifilament suture, there's multiple strands and they're kind of like braided together, which allows for more surface area. The advantage is handling these suture is a little bit easier. They're more pliable. It's easier to tie secure knots with them. The disadvantage is because there's more surface area on the suture and it's braided, it increases your risk for inflammation and infection. So a lot of times these suture, they have the option of coming in like an antibiotic coat so that it will help decrease some of that increased risk for infection. But having those coatings on it, the special antibiotic coating, can be more expensive. So last, I want to talk to you about suture charts and the importance of becoming familiar with suture charts. So I don't want you to have to like read in and zero in on these charts up here. I want you to become familiar with looking up the information. So these are just charts I got off the internet on Google. The big takeaway here is that we have different purveyors of suture. So two common purveyors are like in the US are Ethicon and Covidian. These are companies that manufacture suture, and they have different brand names within them. There's tons of suture, and the most important thing you need to become aware of is that there's a scientific name, and then there's also going to be the common name. So common names would be like Vicryl, Monocryl, PDS, Proline. Become familiar with the common names in your institution and know what those sutures are made of. So we're going to conclude by saying suture is common and it's a reliable option for surgical wound closure and in surgery in general. Suture is very commonly used by RNFAs. Sometimes we're called the closers because we end up suturing a lot of skin. Becoming an RNFA will require you to become comfortable with working with suture. There are many types of suture material and sizes, and as we make more videos, we can go into more detail, and we definitely want to hear your questions so we can try and help field them and answer them to the best of our abilities. But know there's different companies that manufacture sutures, and they're often called different things. So becoming familiar with the material and the sizes is going to really help you. And understanding the difference in suture material will positively contribute to your practice. We just discussed that. And last but not least, your surgeon will dictate the suture used during a surgical case. So you always want to make sure that you're having open communication with your surgical team, talking to your surgeon, making sure that if you are using suture, you're using what they want on the patient. So the surgeon will be making the decision as to what suture is being used during the case. Okay, thanks everyone. Thank you for listening. Bye.